with thousands of travelers returning back to Gauteng from their holiday destinations to check the measures in place and to combat the spread of COVID-19. We're joined now by Nehawu's Gauteng coordinator, Mr. Clement Marule. Very good afternoon to you, sir, and good to have you with us. If you could talk us through some of the concerns that you have regarding the large number of people who are making their way back into Gauteng.
Good afternoon, Tami, and thank you for the opportunity. Yes, indeed, we are worried as a national union about the return of holiday makers into the province. Now that we are now almost in the middle of the second wave, we really are worried. The reports that we've been receiving from the middle of December give a bad reflection that our strategic hospitals in the province are going to be really under stress, and frontline workers are going to be under pressure. As it is, the hospitals that I would mention now, the Krisani Baragwana in Johannesburg, and then in Leratong, in West Rand is Leratong, that has also been affected by the floods. And in George Mukari in Tshwane, also there are numbers of positive cases there. So we've done a random check of the strategic hospitals really, and the signs are that we are going to be really under pressure. Those particular hospitals are going to be under pressure really to deal with the second.
And what are the sentiments on the ground as far as healthcare workers are concerned? What seems to be their main areas of concerns? What are their priorities right now?
I think we, as I said earlier on in our statement, that we, as a province, but also not being isolated from the nation itself, we, as a nation, we've been covered by complacency, really, because regardless of us as a national union sending messages to members, to the employer, management in government, to say we might be on alert level 1, but the virus really still on rampage. So most of the institutions or the hospitals, they have gone to sleep, if one way to say so, and hence now we are now feeling the pressure, because in other hospitals like Krisani Baragwana, management decided to stop provision of the PPEs to the general wards, and saying to frontline workers that they will only provide the PPEs to the COVID-19 wards, and which really to us was uncalled for. So, and secondly, that the PPE committees or the occupational health and safety committees stopped meeting every day to do the monitoring and evaluation of the provision of these PPEs, which was also uncalled for. And we are very happy that the new MEC of Health, immediately after she took office, she did some rounds in strategic hospitals. She went to the stores to check the stock levels, and she also issued an instruction that all these committees, the PPE committees, must start meet frequently, so that we really start monitoring the provision of these PPEs adequately. So,
are you saying then, Mr. Marule, that even though COVID-19 was still a pandemic in the country, that the health sector within Gauteng had really relaxed as far as trying to curb the spread of COVID-19 and making provisions for healthcare workers?
Look, I would not pin it to the Department of Health, but I was just saying, as a province, as a nation, we really got carried away by the pronouncement that we are now on, alert level number 1 and so on. So we're thinking that maybe we are out of the woods. And we were encouraged by the state president when, before he announced alert level 3, when he was in pain, trying to warn our nation to say, really, we should not take this thing for granted, and we should not drop guards insofar as, being alert insofar as fighting this particular pandemic. So, yeah, there was that particular loss of momentum insofar as being really alert insofar as fighting the pandemic itself. So I think that particular period really nearly cost us insofar as us keeping ourselves in that particular fighting mode.
People are only starting to come back to Gauteng now, and perhaps some of the effects of COVID-19 during the holiday season may only be experienced maybe in the next few days or maybe even in the next week. Do you believe that our hospitals are capacitated enough to be able to deal with the prospective influx of individuals in hospitals who may be needing treatment?
We still have to hear from the department, really, because we are having a scheduled meeting with the MEC of Health. We just hear from the news that they have added capacity insofar as the hospital beds and so on and so on. But really, the reports that we are receiving from our members are not showing that, because they are already, complaining that the cases are really increasing and they are really feeling the pinch. That's why we said in our statement earlier on that the public servants and the institutions are really under siege. So we still have to meet with the MEC this week or next week to find really the true facts, where there's been addition of capacity, whether in personnel or in terms of infrastructure and so on. But we will be monitoring that very closely after the meeting with the MEC of Health.
Mr. Marula, over and above the tangibles of PPE provision, of hospital beds, what type of support do healthcare workers need at this particular time? We've been hearing reports of the numbers of healthcare workers perishing from COVID-19 increasing. Do they need psychological help? What help do they need?
Yes, Tam, I think they need all of the above, whether it's the counseling, as we were always saying, that these workers really are under serious stress. On collective bargaining issues also, those issues that are on the collective bargaining table, they are also not doing us a favor, because remember that the public servants are still in a dispute of their salaries for 2020, and they are also not sure about their salary increase for 2021. So those are also some of the things that are really causing a distress to these public servants. As much as we work hard to try to really motivate them to say this is a national fight, but there are those particular issues, whether it's a shortage of staff, late provision of PPEs and so on. Those are package of issues that are really not doing us good insofar as really getting public servants really focused in fighting this pandemic.
With the focus now being on tackling and fighting COVID-19 and reducing the numbers of the spread of the virus, do you believe the issues that you have on the table, the issues that you mentioned of collective bargaining, are you being heard at this particular time? Do you have hope that these are some of the issues that will actually be resolved in light of the fact that COVID-19 seems to have overshadowed the priorities of the department?
Those issues are really costing us, because the morale of public servants, in particular the frontline workers. Remember, on top of those collective bargaining issues of salaries and so on, we also, as a national union, made a demand to government that they, give this particular frontline workers some incentive of some sort, or risk allowance, anything, just to keep them motivated and, and focused. But we could not win that in 2020. But really, one must really admit those particular issues are really a distress to such an extent that even our members are no more, taking any message from us as a national union. Because once we start, talking issues of strategies and ways of fighting COVID-19, they keep on dragging us to those particular collective bargaining that are not being attended to. So we're hoping that government, in particular the office of the president, will really rise up and come to the party to make sure that really these public servants are assisted, because really it is now becoming unfair just to say we're really praying for them, we're encouraging them, but whilst the bread and butter issues are really doing disservice to the morale of this particular workers.
Mr. Marule, thank you so much. Really painting a very clear picture of the dynamics that healthcare workers are facing in Gauteng. That's the Gauteng Provincial Coordinator there for Nehawu, Mr. Clement Marule.